A celebrity couple's heartbreak is shining new light on a common loss, miscarriage. This week, Chrissy Teigen and John Legend announced that they had lost their third child following pregnancy complications. Teigen shared this heartbreaking photo, writing, "It just wasn't enough," on social media. She was hospitalized Sunday after she had experienced bleeding for a month. Both of her other two children were conceived in vitro. This pregnancy, however, happened naturally, something that Teigen said she didn't think was possible. Dr. Kendra Gillespie is an OBGYN from Baptist Health joining us via Zoom this morning. Doctor, thanks for being with us.
Yeah, absolutely. Thank you for having me.
So Teigen has been very public about her battle with fertility problems, and she had said that she had a weak placenta. Can that cause a miscarriage?
It can. Thin or weak placenta is not actually a medical term. And of course, I respect their privacy completely. It's been a little difficult trying to figure out what her diagnosis actually was. Based on her story, I've seen the videos that she posted, and based on what she described was happening, it sounds like she may have had something that we refer to as a placenta previa or possibly a placental abruption. And both of those conditions can affect the nutrition that goes to the baby, because obviously the placenta is the organ that has that purpose to pass on nutrition to the baby. But a previa is when the placenta covers the exit from the womb. And if that happens, she can have excessive bleeding, or mom can have excessive bleeding requiring transfusion. Same thing with the abruption, which is the other term that I mentioned, which is when the placenta separates off of the wall of the womb. And so with either of those conditions, you can have excessive bleeding that can also compromise the nutrition to the baby.
Yeah, so it's interesting because she also posted on social media that she was having, quote, bags and bags of blood transfusion,
Right.
which might make sense based on what you've just said.
Right.
Is the purpose of that transfusion basically for her and her life, or is it for the sustainability of the child?
Yeah, mostly it is to help mom, because that's maternal blood loss, so it's mom losing blood. And she described many times in her videos that the baby was actually growing pretty well and, strong, as she described it. So it sounded like the baby was actually doing pretty well. It was more so to keep up her losses.
Yeah, what a mother wouldn't do to save their child, or
Right.
just. So she announced her pregnancy in August, and
Right.
it's been reported that she was about halfway through her pregnancy. How common is a miscarriage that far along in a pregnancy?
Yeah. So when describing the term miscarriage, the definition is actually a loss of a pregnancy before 20 weeks. So it sounds like she was just above that. We do see it more commonly in the first trimester. So about 1 in 4 women will experience a loss of a pregnancy in that first trimester. As we move beyond that, the chances decrease to about 1 in 10 women. So it definitely is decreased as time moves along.
Is there anything that a woman can do to reduce the risk of miscarriage if, she is considered high risk based on age or her medical condition?
Yeah, so it depends on whether we know the cause of a prior miscarriage or if we know that the patient is at risk. And the best way to do that is to try and control those conditions that we know are contributing to the potential for loss. So controlling medical conditions very well. A placenta previa, or a different kind of abnormality with the placenta, is unfortunately not something that we can always predict, and not something, in Chrissy's situation, it was more so treating the symptoms rather treating the problem, because it's just not something that we can do anything about. But knowing things beforehand that are preventable, we can definitely intervene early on.
Hey, Doctor, thank you for your time this morning. I think it's about highlighting, and this is a tremendous grief for anyone who experiences something like this. And
Yeah, very heartbreaking.
we love our babies, and it's
Right.
just so difficult for anybody experiencing it. So thank you for your guidance.
Yeah, absolutely.
We'll be right back.